Hey guys, you're having chronic back problems or maybe an acute problem. You finally go get a test and you hear your providers throw around terms like bulge, herniation, L12, L34, L5S1, or even the protrusion. There's a lot of terminology, a lot of things going on your head. A lot of times you're just taking it all in and you just don't know what to ask. This is the video to watch to kind of help you understand some of the terminologies we use every day, and a lot of times don't take the time to really help the patient understand what they got going on. Okay, I'm Andy Austin, 19 years a nurse practitioner in interventional pain management. So basically when we talk about problems going on the back, we're talking about disc problems. This is what we're going to talk about mainly today. Bulges or herniations, okay? So a disc bulge, when we look at an MRI report, we're looking at the integrity of the disc. What's the disc doing, what the joints are doing, what's the spinal stenosis, all these types of things. And if you want to know more about spinal stenosis, I have a video as well posted. Go and check that out. Also, if you want to know more about discogenic back pain, the anatomy of the disc that we're going to be covering, I have a video about that as well. But what we're talking about today is primarily terminology, okay? So in the lumbar spine, you have typically 5 discs, okay? And the way we name these discs, we give them an L for lumbar and 2 numbers. So I wrote them over here on the side. L12, that's 1 disc. L23, that's another. L34 is the 3rd one. L45 is the 4th one, and L5S1 is the 5th one. So that's how we name these guys, okay? That's L5S1, 4-5, 3-4, 2-3, 1-2, okay? So when you hear a provider tell you you have a disc bulge at L45, that's what you're talking about. The 4th disc in the lumbar spine, you have a disc bulge, okay? Now that we got the numbering system down, what's a bulge? What's a herniation and what's a protrusion? Okay, so when we're talking about disc problems, we're looking at, this is a cross section of the disc, okay? And we're looking at the nucleus. The nucleus is that thick gelatinous substance in the middle of the disc, surrounded by rings, okay? And when you have a disc bulge, you start over time, start having movement in this nucleus, okay? It's starting to try to bulge backwards, okay? This is the front of the body, this is the back of the body. The red are nerves, okay? So if you're coming in and you're having mainly lower back pain with no leg pain, there's a good chance you're gonna have a disc bulge and not necessarily have a disc herniation. I'll show you why in a minute. So a disc bulge typically is used, terminology is used to describe some slight movement, some slight bulging of not only the annular rings backwards, but also it's starting to cause some movement in that nucleus. The nucleus is starting to bulge backwards, okay? That's an indication that you're having some deterioration in the integrity of the disc, okay? That can be changed and improved with conservative treatment, okay? Although it can cause lower back pain itself. What you don't want to happen is to progress into herniation, okay, or protrusion. Herniation and protrusion are interchangeable. What that means, what they're describing is a herniation of the nucleus itself, okay? The inside thick gelatinous material has squirted out backwards through these rings that's supposed to keep it all nice and tight, and now it's occupying space and it's crowding and putting pressure, in a lot of cases, putting direct pressure on a nerve root, okay? And that's when you start having a lot of sciatica pain going down the leg, okay? There's other conditions such as spinal stenosis, and again, we have a video on that. Go and check it out. But in general, if you're gonna have one, you wanna have this one and not this one, okay? But I hope that kind of clears some terminology up for you. I hope you enjoyed the video. If you have any questions, don't hesitate to contact your primary care provider or your spine surgeon or whomever's been working with you, chiropractor, physical therapy. Try the conservative treatments. Get up and walk. Regardless, both conditions are better with walking. You can help with the pain. Also, if you ever develop any sudden weakness, numbness, worsening of pain, contact your primary care or your specialist ASAP. All right? I hope you enjoyed it. And again, if you want to know more, a deeper dive into these conditions such as discogenic back pain, pain coming from the disc itself, check out this video right here, okay? And if you have spinal stenosis, narrowing of the holes, check out that video right there, all right? We're here for you. If you have any other questions or other topics you want to cover, put them down in the comments. Thanks so much. Have a good night.